Okay, if we come on, let's get started. Director Williams, Dr. Purse, Chief Pena, Chief Acevedo. Good afternoon. Quite frankly, normally I would, in the last, I guess, couple of months, I've only had these press conferences on a Monday. Decided to do it today on Thursday with the rising number of cases in our hospital and the positivity rate increasing. Simply want to reinforce the message that it's important for all of us to continue to be very vigilant and continue to be mindful of our behavior, and that we need to work collectively to blunt the progression of this virus. There are more than 2,000 people that are now in our hospitals, and then during the summer it was roughly 2,400, a little bit more than 2,400. So now that we have more than 2,000 people in our hospitals, I simply want to reinforce the importance of us pumping the brakes. We all need to pump the brakes and to make a very strong appeal to people to engage in social separation and to keep their masks on and to wash your hands, use the sanitizer. I want to go back to where we started in March and to remind people again, because we don't want to get to the situation where there's not any hospital capacity. So I want to really pump. I want to hit the brakes hard. And today I want to hold this press conference on Thursday before the weekend comes to remind people of the severity of the situation in our area. Let me just say, over the last 24 hours have been a roller coaster of unbelievable emotions as our country witnessed a shocking attack on our democracy, as people rioted and committed acts of violence inside the nation's capital. Totally incredulous, unbelievable. Like most Americans, I am relieved that the House and Senate did its job to ratify President-elect Joe Biden's Electoral College win. He and Vice President-elect Kamala Harris will be sworn in about 2 weeks from today. But I'm also stunned and disappointed, and I will say disappointed is really an understatement, by the blatant disrespect exhibited by that mob who acted in a direct attempt to prevent the peaceful transition of power. It was a national disgrace and an international embarrassment. We'll talk more about that in a few minutes because we're still working to stop the spread of a deadly virus in our community and provide COVID-19 vaccinations as the supply becomes available. And again, and quite frankly, in view of what happened yesterday, I thought it was very important for us to have this conversation about this coronavirus because I don't want people to lose focus on an enemy that we are fighting in every city in the United States and cities around the globe. Today, the health department reports 1,586 cases of COVID-19, bringing Houston's total to 124,712. So 1,586. It's a sobering number, but it's a reminder that this virus is still very much in our city. We're also today reporting the deaths of 4 persons who have now died as a result of this virus, bringing the death count in the city of Houston to 1,580. And that number continues to rise. And then if it wasn't really at the forefront this morning as I was coming in to work, a person who I know very well called me. I could tell his voice was a little faint, but called me He was calling from his hospital bed. I did not even know he was in the hospital. And he wanted me to know he was in the hospital and which hospital. And then he said, Mayor, I don't want to die. And that was just this morning. And so reached out to the hospital just to let them know, I know this person. And like I know they're providing care to everyone, but he simply wanted me to call the hospital to let them know that he knows me. Okay. But again, it reinforces the seriousness and the magnitude and the personal nature of this situation. Okay. So I just want to say to people, as you party hardy in the clubs, I hope while you're taking that drink, that the picture of someone in the hospital flashes in your mind. They may cause you to put down that drink and go home, okay? But stay away from crowds. And then today, as you already know, we are learning about the confirmed case of the new COVID-19 variant, B117, which is in Harris County. And quite frankly, and Dr. Purse can speak on it later, if it's in Harris County, it's in the city of Houston, okay? That's just my attitude. It's just that close. And so I want to stress there are no confirmed cases in the city of Houston, unless Dr. Purse corrects me. But given that the person is a man 30 to 40 years old, he could very likely have family and friends in the city, and we do not want to assume that we won't see the case inside the city, and I just assume that it's already here. People still need to take precautions like masking up, practicing social distancing, and washing your hands to help stop the spread of COVID-19 as people get vaccinated and we learn more about the immunity produced by the vaccine. I know many Houstonians are excited and anxious about getting their first dose of the COVID-19 vaccine. The city of Houston is continuing to work on opening a super site for COVID-19 vaccinations. It's always contingent on the supply, as Director Williams constantly is reminding me. The Houston Health Department is working feverishly on logistics, staffing, and a traffic and parking plan. But the vaccine supply is the only thing that we do not control. And this weekend, we are partnering with the Astros Foundation to operate Minute Maid Park as a COVID-19 vaccination site on Saturday, January the 9th. But let me just say this. It is a change of venue from the Bayou Center, but it is not going to be a mega site this week, okay? We're changing venue. It's not going to be a mega vaccination site this week because we just don't have the supply. The site is open only to people who already have appointments scheduled at the Health Department's Bayou City Events Center Clinic, or which will close for an unrelated weekend event. So the Bayou Center is scheduled to close. We are transferring the venue to Minute Maid, but it's not the mega site that I was hoping to get because all this week we've been trying to get more supply, and we just haven't been able to get more supply. And the supply, as you know, comes from the CDC down to the state and then to us. And they're saying next week, they're telling me, Mayor, next week we'll be providing more. But for this week, we are going to be limited. So I don't describe it as a mega site. It is just a change of venue. The health department is in the process of contacting people with appointments to inform them of the new location and provide instructions on what to do upon arrival. Only people with appointments should go to Minute Maid Park. Others will be turned away. As more supply becomes available in the coming days, we will then have additional supply to vaccinate more people in the coming days, but we are waiting on confirmation from the state. That's part of the frustrating part of this. Everybody wants to get out quickly, but we are at the end of the chain, and what we do is limited by what we receive. And as of this morning, the Houston Health Department has received a total of 13,800 doses of the Moderna vaccine. of that allotment, the Houston Health Department has been administering this vaccine to about 1,000 people a day. And I want to thank Director Williams. Where is he? Yes, I want to thank Director Williams and his staff for their work. They're doing about 1,000 a day, and I'm very appreciative to that. And in addition, the Department of Health has also transferred 1,900 doses to other providers. And that's not including the 2,000 doses that the Houston Fire Department transferred over to Harris County. Most doses administered by the Health Department were provided at Bayou City Event Center. The department also administered vaccine at its north side, La Nueva Casa de Amigos. That was pretty good, wasn't it? Tutors do work, you know. Just give me a couple more months, you know. I'm going to speak in Spanish, then I'm going to translate it in English. Mayor Pro Tem, you better come over with me now. And then to Sharpstown and to the Sunnyside Health Centers. And right now, all appointments for Houston Health Department vaccine clinics are filled for the remainder of January 2021, based on the department's current vaccine. So as we get more, we can do more. But no additional appointments are being made at this time. Appointments are based on vaccine availability and may be adjusted based on the department's allotment. Finally, the department will announce additional vaccinations opportunities at multi-service centers, health centers, community locations, and mobile units as supply increases. Let me thank Chief Acevedo. Let me thank HPD for doing a terrific job on traffic management over the weekend. Really came in place, very quickly, set it up. Things ran very efficiently. So I want to thank HPD for their collaboration. And let me thank the Houston Fire Department, Chief Pena. Let me thank you all and what you all are doing and making sure we get our firefighters, MS workers vaccinated. So I want to thank you also very, very much. Let me start today with Director Williams, because he is and his team are the ones responsible for the vaccine, the shots themselves, and then we'll turn to Dr. Peirce. Director Williams. Oh, I do want to acknowledge Mayor Pro Tem Martin and Councilmember Carlos Cisneros.
Thank you, Mayor. As the Mayor said, we will be changing locations for vaccine administering this weekend. We're also going to use that venue as an opportunity to model how we can actually ramp up the number of doses that we can give. I think last week you heard the challenge that he gave me, and I'm glad he really said that what we can do is based on what we in fact get. I want to thank our partners at the police department and at Minute Maid for helping us to work out the logistics of that. We expect it to be successful. As more vaccine becomes available, we will start to roll out vaccine administration at health centers, community location, and mobile units as the supply increase. And hopefully next week, we expect to get more vaccine than we had this week. People can use our HoustonEmergency.org COVID-19 to view the Texas COVID-19 vaccine provider locations map to see and call nearby providers to explore exactly where you might be able to get that. And let's remember that we're now looking at priority 1A and 1B. Priority 1A is primarily those individuals that are involved in health care. 1B are those individuals 65 and above or 16 and above with chronic conditions. As vaccine becomes available, more vaccines will be available in doctor's offices, in your local pharmacies, and in a variety of locations so that it can be more accessible. People, as the Mayor said, need to continue to mask up, social distance, wash your hands, and get tested. We're still offering testing in the city of Houston. Although vaccine is available, it's absolutely necessary that we continue to make testing available. And on vaccines, we want everybody to be ready to really take your best shot when it's your time to take the vaccine. It is something that we believe is safe, and a number of us on this stage have already done that, demonstrating that we trust the vaccine.
Thank you, Mayor. Thank you, Director Williams. I'm going to talk about three things quickly. One is the new variant case. That is a Harris County case, so they have all the detail on it. I'll tell you what I know of that case that I think is important. Number one is it's an adult male, lives outside the city in southwest Harris County. That person has no travel history. They are checking all the close contacts of that person, and so far none of those people have any history of travel either. So that suggests that, as the mayor pointed out, that this person was probably infected here in the local area, and quite honestly, that shouldn't be a terrible surprise to us, because as we saw the virus erupting, if you will, across England, and then we saw a couple of cases here in the United States, because of this virus's characteristic that is more easily transmitted, it shouldn't surprise us that it came to a large metropolitan area like Houston. Now, that's the bad news. The good news is that this virus, this variant, does not appear to make people any more ill. It spreads more easily, but doesn't make any people any more ill. So that's good news. The other good news is, and having double-checked again today with some of our vaccine experts, they have every reason to believe that the vaccine that is being distributed here in the United States will, in fact, work just as well against the new variant as the predominant strain of vaccine that's been across the United States. So again, that's good news. So the point is with those things is that we need to not, overreact to this news. We need to take it for what it is. We need to continue those things that are going to protect us. Mask up, wash your hands, stay distant, be diligent about your proximity to other folks and going to clubs and large gatherings. Remember, so this individual was probably infected by somebody else here. Remember, we have a huge percentage of the population who is infected and has zero symptoms. In fact, I talked with a firefighter today who got themselves randomly tested and was positive, and they just couldn't believe it because they had zero symptoms, none at all, no symptoms whatsoever. And then they did the right thing, and they took care of themselves and their family. But their comment to me was that they just couldn't believe that they had absolutely no symptoms. But that's one of the challenges with this virus. So the good news is that the vaccine will work. And then the other good news is just a couple of days ago, the CDC issued its first report on vaccine side effects. And so the first 1.9 million doses of the Pfizer vaccine, there were 21 cases of anaphylaxis. 21 cases out of 1.9 million doses given, and no deaths. So, I think that illustrates, certainly with ongoing information, that the risk with the vaccine is very, very low. We have increasing risk with the new variants coming. We need to do all the things that we've been doing, just remain diligent.
Thank you, Dr. Peirce. I will tell you, I am on day 4 of receiving the vaccine, and so I am good. Arm is not sore, and I'm not sluggish. I'm feeling fine. So let me just say, this is day 4, feeling pretty good. So all is well. Now let me turn to in terms, I said the health department's giving out about 1,000 vaccines a day. The total count on that is 8,169. So 8,169 from the City of Houston Health Department alone. That's not the other providers or even the doses for EMS or from the hospitals. That's just from the City of Houston's Health Department, 8,169 as of this morning. Okay, let me start with Chief Pinion, followed by Chief Acevedo.
Thank you, Mayor. I want to first thank all the people that are up here, especially Mayor Turner for pushing the departments to get these vaccines rolled out to all the 1A and 1B in our qualifying in our community, and especially to Stephen Williams and his team for stepping up to the challenge and quickly pivoting to be able to meet that demand. The Houston Fire Department, we're doing our part as well in vaccinating our personnel and making opportunities available to our personnel to get vaccinated. I want to thank Methodist for their assistance in vaccinating our personnel. I want to thank St. Luke's, and I want to thank Herman for also making vaccine opportunities available to our personnel. They've been a great partner, and we truly appreciate their efforts. This week, we accepted an additional batch of vaccines. We don't have them in hand. We will make those vaccines available to our personnel, and then we will also coordinate with the health department to ensure that we're meeting the needs in our community for vaccine availability. Today, we are at 94 firefighters that are positive for coronavirus. We have 260 firefighters that are currently in quarantine, and all of them are recovering at home. We don't have any firefighters in the hospital, and I highly encourage all our first responders, firefighters, paramedics, police officers, municipal employees, and the general public who qualifies for 1 Alpha or 1 Bravo for the COVID vaccine to go out and make an appointment and get vaccinated. The science is solid. Dr. Peirce mentioned the effects, and so we encourage our community to please take advantage of these opportunities and help us stem the spread of this virus. Thank you, Mayor.
Thank you, Chief. And Chief Acevedo, as he comes and give us a report as it relates to HPD, I would also like for him to just cover on additional security measures. As you can see, there's a greater police presence even around City Hall and city facilities. So, Chief Acevedo.
Thank you, Mayor. Good afternoon, Mayor. Thanks for having us. And as of this afternoon, we have 343 members of the Houston Police Department that are not at work because of COVID for either quarantining or positive for COVID. I'm still happy to report that we have not had any additional loss of life. In terms of our operational capability, we're fully operational and fully functional and meeting all the demands of the city and of the community. And we have not seen or noticed any degradation of our operational capabilities as a result of COVID. And I think a big part of that, Mayor, is the additional dollars and the constant support that you've been giving us over the last almost going on a year pretty soon on this COVID. In terms of what happened at the Capitol yesterday, we know there's a lot of concern around the city and around the country about the security. At the direction of the mayor, we have increased our footprint, not just at City Hall, but across the city. We are monitoring sensitive sites. And let me just say something that I've said before, and I'll say again. This is the city of Houston. We're very proud to protect and to facilitate First Amendment activity. I think we demonstrated that during the summer with the George Floyd protest. We really believe in it. It's our constitutional duty to support First Amendment activity, but there's a very distinct and very obvious line when you go from First Amendment activity to criminal activity. We are fully prepared to respond to any threat in our city. I would just tell the public that we are constantly monitoring our area of responsibility along with our federal, state, and county partners, and there are no known specific threats. We have had demonstrations, as we had today, but our demonstrations, thankfully, have been peaceful, and we anticipate that continue that way. En español, bien rápido, tenemos 343 oficiales que no están en trabajo por el virus. Es muy importante, como dice el alcalde, han dado la vacuna, la ciudad, solamente la ciudad, a más de 8,100 personas, y también los bomberos han dado la vacuna a muchos de nuestros habitantes. Por favor, sabemos no tenemos suficientes vacunas, así que siga cuidándose con su máscara, lavándose las manos, y más importante, manteniendo la distancia. También sabemos que hay mucho temor sobre lo que ocurrió en Washington. El Departamento de Policía de Houston estamos preparados para cualquier evento aquí en la ciudad. No vamos a permitir ninguna clase de violencia en esta ciudad. Protesta sí, criminalidad no, y violencia no lo vamos a permitir. And that's my report, Mayor. Thank you.
Thanks, Chief. And lastly, what I would say is that that riot at the nation's capital on yesterday showed a glaring double standard in America. The mob incited by some congressional elected officials and the White House was shameful and an international embarrassment to our country. Americans cannot turn a blind eye to what happened on yesterday, and I strongly condemn the violence and the lawlessness. And let me just say this. You cannot work to create a fire, and then after it starts, attempt to throw some water on it and think you're going to be applauded. If you start the fire, you're responsible for the fire. And America should not applaud people who started the fire and then condemn the violence after the fire erupted. You should get no credit for that. None. N-O-N-E. And what happened yesterday will live certainly in my mind for a long, long time. So can't turn a blind eye to it, can't ignore it, can't try to water it down, but it does, and it did. It presented itself to America and showed that we are still operating under a double standard, and that is unfortunate. Having said all of that, we'll stop, take whatever questions or comments anyone may have.
Answered most of the questions that I have from different stations. From KHOU, the vaccination super sites that you spoke about already, is that something that's going to be continuing?
It's one that's it will start. We're changing the location. I won't call this Saturday as a super site because it's limited based on the supply that we have received. So I won't call it a super site, but the infrastructure is in place. Once we get more vaccines, then it is ready to turn into what I call a super site. I define a super site when you're able to vaccinate anywhere between, let's say, 3,000, 5,000, 6,000 people in that single day. We won't be able to get up to that number because we just don't have the supply. But we're ready. Once the state gives us more, then we can quickly turn it into what I call a super site. For now, we'll be able to do more than 1,000 or so. And it's by appointments. Those spots have already been taken. So we are in telling people, don't show up. It's already by appointments. But what I am told is that next week that this area will receive a significant shipment. And then I'm hopeful that the following Saturday, we can say it is indeed a mega site.
It's something that you plan on continuing as long as needed, or?
Yes, I mean, the goal was to try to set this type of site up like every Saturday, okay? And so I'm hopeful that based on shipments that they're telling us will be coming in next week, that we'll be able to stand it up in a major way. Director Williams, you want to amplify that if I stated that?
Thank you, Mayor. No, actually, as I said, the mayor challenged us to develop what he calls a mega site or a mega site. It's really based on vaccine availability. Even if we got double the doses of vaccine that we got next week that we got this week, we're still seeing people every day. And so come Wednesday or Thursday, we'll be able to project how much vaccine we would have available for this mega site. Now, remember, this is going to improve as time goes on. Now we know that there are several vaccines that are going through trials, and hopefully more vaccine would be available. So I believe that it is a very good idea for us to really model what we would do, because the goal is to really vaccinate as many people as possible.
And look, my goal is to get. We're doing, for example, the health department we're doing over 1,000 a day, okay? But that's not going to get us where we need to be in the shortest period of time, which means we need to do exponentially more. And when I say a mega site, I am talking about being able to do like 5,000 vaccinations at one location in a single day. And that's going to depend on us getting the added supply. And what the state is saying, next week more is coming, but that's the goal, because we are not going to get it out as quickly as we need to get it out, and be able to say by the end of April or May that 65-70% of Houstonians have been vaccinated. We have to move a lot quicker, and we need the CDC to provide more to the state, and the state to provide more to the cities and the counties, so that we can get it out. So we're just not moving as fast as I would like to move, but we're moving as fast as we can with the availability, with the supply that we are being given.
With yesterday's events, is there going to be any security heightened around City Hall?
It is already heightened. I see Chief Aceveda, Chief Fenner, Chief Slinkert, Chief Satterwhite, all my others, and then those that we don't see. And then I'm ready too.
And then for my station, KRIV, Dominic Keith wanted me to ask you, you already kind of spoke about it, but tell me a little more about the tweet that you sent out yesterday.
Which one?
The double standard, I'm sorry.
The double standard. Look, during the summer, during the George Floyd protests, even the White House and other elected officials, governors and others, were calling people thugs, was talking about the lack of law and order, was saying we needed to send in troops to deal with these protesters, peaceful protesters, I might add. And you had strong law enforcement, the National Guard in D.C., all of that. But yesterday, there were thousands of people who were in D.C. who stormed the nation's capital, knocking out windows, all in the hallways of Congress, taking over people's offices, taking pictures, okay? It was the way the situation was handled. It was as if this mob was entitled, okay? Privilege, what I call privileged mobsters. It's a double standard. And I don't want to sugarcoat it because America must deal with it, okay? America must deal with it. And quite frankly, it was very painful. I heard from my daughter and others who said, Dad, they didn't treat them the same that they treat the protesters during the summer. Okay? And I had to agree. And I didn't hear people, the same ones talking about this lack of lawlessness in the summer, referring to this crowd. They were not patriots yesterday, okay? They were not patriots. They were a mob carrying the United States flag. And they were criminals. They were a national disgrace, and they were an international embarrassment. And quite frankly, they ought to be picked up, okay? Whenever you get to the point where you can be a criminal and you don't mind being on television and taking pictures because you don't think you're going to be arrested, handcuffed, okay? No, it was a double standard, a glaring double standard. And we need to call it for what it is and not try to sanitize it. And for elected officials who incited it, who've been carrying out this foolishness, and then all of a sudden to talk about the violence, you're opposed to violence, whether it's from the left or from the right, you get no credit. If a person starts a fire, and then that person, after the fire has started, starts putting water on it, we don't say to the person who started the fire, thank you for putting water on a fire that you started. You started the fire. And many of these elected officials at high levels, not just Donald Trump. And I think we make a mistake when we just focus on Donald Trump. You have to focus on the enablers. Those who stood up a Donald Trump. Those who are perpetuating these falsehoods. They are the enablers. And you have to call them out. Okay? And you get no credit for all of a sudden talking about we are opposed to violence when you incited people to do it. What happened yesterday was not unforeseen. And the very fact that people were not prepared for it, is an indictment in and of itself. And the very fact if people allowed them to come in and treated them as if they were okay is an indictment in and of itself. It was a double standard. It was a glaring public double standard before the international cameras in 2021. by people who were carrying the United States flag. No, I'm sorry. You get no credit from me. Absolutely none.
Thank you, Mayor.
Okay. Thank you. Oh, I'm sorry.
Can I have just another question for Dr. Purse real quick?
Oh, yes, he's anxious to answer.
From KHOU, just basically you spoke about the variant. How much do you think that's going to affect the Houston area, and is the hospital ready for another surge?
Yeah, so, I mean, you're asking me to look into my crystal ball, right? So, I see, you can see the graphs, or the hospitalizations are already going up. So this new variant runs the risk of making that increase in hospitalizations, that curve, get even steeper. And we're already pretty much maxed out on our local hospitals. And, this is not gonna help. So a couple of things. We'll be talking with the hospital CEOs again tomorrow. We speak twice a week. I'm sure this will be, first on our list of agenda to talk about is the potential impact and how to prepare for that. But in addition, I think that the public needs to understand that at the end of the day, I want us to remember what happened in the second half of July and August. The people in this community changed their behavior and we drove the infections down. Right? We did things. We, people, regular people, are actually empowered. In fact, they are the answer. Like, the vaccine is just barely here. We've had enough vaccine in town to vaccinate, 1% of the population? It's going to take a long time before we're going to reach herd immunity. So until that occurs, I think we need to recognize the vaccine is here, appreciate the vaccine is here, but we need to really focus on what are those things that we can do. We did this twice already. Now, the first wave wasn't very big back in March, but in July, that was a substantial wave. And we drove it down because we wore the mask, we social distanced, we did all those things we need to do. We can do that again. And this new variant, I don't think that we need to be afraid of it, but we do need to be challenged by it. And I think, personally, I think we need to see it as a challenge on this community to see how we're done. The other thing is that, keep in mind that when you look at the numbers here in Houston, while they're moving the wrong direction, we are still in much better shape than most of the rest of Texas and the rest of the United States. And I think that's a testament to Houstonians and the people in Harris County that, we can and have and do step up to the plate. Now we need to do it again. And I know everybody's fatigued. I know everybody's tired. We're all sick of this. I get it. But boy, oh boy, now is the time to really put the foot on the brake.
Thank you.
Hello, Mayor. Some people have told me that when you go through the City of Houston website to make an appointment to get the vaccine, the system requests the health insurance information. Could you confirm if that's true, and if it is, why the system is request that information if the vaccine is for free?
I've got to look at it myself, but Director Williams, any idea?
That is actually on one of the forms, but we're not charging people to get vaccinated.
And why that is information is requested?
I'm not really sure, to be honest with you. I just, only reason I know it's on the form is because I filled it out and put my insurance name on it. But we don't charge.
Okay, thank you.
Yeah, and let me say, you can leave it blank. Yeah, because I want to make it very, very clear. There is no charge at all for this vaccine, okay? It should be no charge from the hospitals, from the City of Houston Health Clinic, from Harris County, from any of the providers. There is absolutely no charge for this vaccine. If anybody tries to charge you, please do not pay. There is absolutely no charge. These vaccines are absolutely free. And so if you look at any form and if it asks you about health insurance, you can just leave it blank. Okay? We're not charging anybody's health insurance. We're not going to charge you. We want you to get the vaccine. And I don't care who you are, where you come from, what your language is, ethnicity, it doesn't matter. We want you to get the vaccine, okay? No charge.
I suppose that there are an option that, like, I don't have health insurance or something like that.
Yes. Yeah.
Chief Peña, maybe you can tell me that in Spanish?
I was just about to tell you that in Spanish. But since you specifically asked for Chief Peña, I will step aside.
Mire, sí, queremos aclarar que las vacunas del coronavirus son absolutamente gratis. En la forma, si llenan la forma cuando hacen su cita para tomar las vacunas, hay un lugar donde preguntan de información acerca de seguro. de médico. Ese lo pueden dejar sin llenar, ¿sí? Porque no va a haber cargo para recibir esta vacuna. Lo mismo con el sitio en el website, si están llenando la forma electrónicamente para su cita para tomar la vacuna, ese lugar donde preguntan por seguro lo pueden dejar sin llenar. No va a haber cargo. Como dijo el alcalde Turner, si hay un cargo, él recomienda que no se pague, porque esta vacuna es absolutamente gratuita para nuestra comunidad. ¿Sí?
Come say DC free.
Gratuita. Gratis.
Yes. Yes. Vaccine es gratis. Sí. Yes, no dinero. Okay. Thank you all so very much.